Every day, millions of people silently ride an emotional roller coaster, sometimes flying high with energy and ambition, other times crashing into despair and exhaustion. What they may not realize is this could be bipolar disorder. Hi and welcome. Today we are going deeper than just clinical definitions. We are unpacking what bipolar disorder actually looks like in daily life. The patterns, the struggles, the signs you can observe, whether in yourself or someone you care about. Bipolar disorder is a mental health condition defined by extreme shifts in mood, energy, and activity levels. It's not just being moody, it's a cycle of powerful highs and devastating lows. There are three types of bipolar disorder. The first is bipolar 1, at least one manic episode, often followed by depression. Bipolar 2 is at least one hypomanic episode and one or more depressive episodes. Whereas the third is called cyclothymia, long term, milder mood swings lasting more than 2 years. Coming to the quick clinical breakdown, mania is euphoria, grandiosity, sleeplessness, impulsive decisions, and possibly psychosis. Whereas hypomania, a lighter version, elevated mood, energy, irritability, but no psychosis. Whereas depression, overwhelming sadness, low energy, lack of interest, and feelings of worthlessness. Now let's bring that clinical knowledge into real life. The common real life patterns include the sudden shift. Someone is super social, full of big ideas, barely sleeps, and a week later they are withdrawn, unreachable, or in tears. Overcommitting, signing up for 5 projects at once, overspending, or planning big life changes, then canceling everything suddenly. Talking fast, jumping topics. During hypomania or mania, speech can become rapid and hard to follow. It's like the mind is racing too fast to keep up. Inconsistent productivity. One week they are working 12 hours a day and thriving, the next they can't leave their bed or answer texts. Sleep patterns in mania is generally 2 to 3 hours of sleep but feel wired, whereas in depression, sleeping 10 plus hours and still exhausted. Whereas irritability and conflict is easily agitated, reactive, or overly confident, leading to arguments or tensions at work and home. Many people with bipolar don't realize something's wrong until it seriously disrupts their life. Here's what to watch for. Signs during manic or hypomanic phases include unusual confidence or risk taking, rapid speech, changing topics frequently, spending sprees, impulsive business ventures, increased libido or sudden promiscuity, sleeping little or feeling invincible. Whereas signs during depressive phases include talking about hopelessness or feeling empty, loss of interest in things they used to love, trouble concentrating or making decisions, physically slowing or agitating or isolating from friends and family. The patterns to look for include recurring highs and lows, sometimes seasonal, functioning well at times, crashing hard at others, and not being themselves for a period of days or weeks. Now, what are the emotions behind these symptoms? Internal experiences during mania include I can do anything, or no one can understand my genius, or I don't need sleep, I'm just inspired. Whereas mania can feel like exciting and powerful, but also out of control and scary in hindsight. Whereas during depression, the common terms are I'm a burden, why even try, or the world would be better without me. This emotional contrast can make people question their identity. They often ask, which one is the real me? The answer is both are part of you, but neither should be in control. Now, what triggers bipolar episodes? The common triggers include lack of sleep, stressful life events, including breakups, job loss, substance use, like alcohol, drugs, can destabilize moods, medication with non compliance, and seasonal changes. People with bipolar disorder often live in fear of their next episode. Recognizing triggers and building routines around them is key to staying stable. Coming towards the coping strategies and lifestyle management. Now, the therapy approaches include cognitive behavioral therapy, interpersonal and social rhyme therapy, and family focused therapy. Medications can also help, but as a supporting therapy like mood stabilizers, antipsychotics, antidepressants. Lifestyle tools are very important in dealing with bipolar disorders that include mood tracking apps like Dailyo or eMoods, structured routines like sleeps, meals, and exercises, avoiding stimulants like caffeine or alcohol, building a supporting network, and creating a crisis plan for high risk periods. Managing bipolar is like managing diabetes or asthma. It requires daily attention, not just emergency care. Coming over to some myths, stigmas, and misdiagnoses. The common myths include bipolar people are violent, which is actually false. They are just dramatic. It is oversimplified and harmful. It's just mood swings. It is much more than that. Bipolar is often misdiagnosed as unipolar depression. Hypomania often goes unnoticed, and cultural and gender biases affect the diagnosis. Bipolar disorder doesn't look the same in everyone, and stigma prevents many from seeking help. Coming to the final thoughts. Living with bipolar isn't easy, but it's not a life sentence either. With the right tools, people thrive in relationships, careers, and communities. Notice patterns, not isolated moments. Have empathy, not just for others, but for yourself. Encourage professional help, not judgment. Bipolar disorder may shape your path, but it doesn't define your destination. Thank you for watching this video. Don't forget to like, share, and subscribe.